Yes, so we had very interesting studies presented at ESOC. We already discussed the exclusivity trial, but several other important studies were presented. For example, the CoVasc-ICH trial. It's still like a pilot phase, but really showed interesting results, and we look forward to seeing the final results of the trial. Also, the TenCRAOS study assessing patients with central retinal artery occlusion, which had neutral results, is also something important for clinical practice. Of course, this evidence should be taken together with other studies for the same question, but overall, it is a very important study on a very specific topic that is relatively rare in clinical practice, but still, it's an important clinical question. We also had the SERS tandem prospective retrospective analysis. So this was a study assessing patients with stenting versus non-stenting with tandem occlusion, so carotid occlusion and top of carotid or MCA occlusion. And the results, even after a lot of analysis and controlling for confounders, suggested that the outcomes were better for patients with stenting. And again, this is a question and a clinical scenario that is very common in clinical practice for all clinicians, and there is a very large cohort of around 4,000 patients. So it is important, a very important study as well, although it is not a randomized controlled trial. So indeed, we had very interesting results. Also, the trial from Switzerland, the ESTREL trial on the use of levodopa on patients for stroke rehabilitation. That's also important information for clinical practice, although it was neutral, but still a lot of data being presented at the conference. A lot of trials and covering both the acute phase, the rehabilitation phase, the stroke prevention. So it was a very lively clinical trial session. So in the 3 days, the 3 clinical trial sessions.